We have seen it in the Olympics, we've seen it in airline pilots studying, we've seen it all over the place. Virtual reality. It seems like it's been part of the future, but it's sneaking into the present. I'm wondering whether or not you guys can use it to help patients see what they might look like.
I think it's inevitable. I think we've got 3D imaging for rhinoplasty and breast, and I think virtual reality is just an extension of the technology. I don't think there's been a lot of precedent for problems with 3D imaging, so I don't anticipate there to be major problems with making false promises and all the things that we hear people talk about. So I think it's good, it's technology, we're going to use it.
Yeah, absolutely, I agree. I think 3D imaging, for example, has been incredibly valuable in my practice. It helps patients kind of see what they can expect. It helps manage expectations as well. And virtual reality is just the next step. It might even be helpful for someone, let's say, who's not sure and wants to kind of see what it might look like on their body, and maybe they can do it from the comfort of their home, or maybe they can do it on their own time, but I think it will be very helpful.
Yeah, I think it's important to be realistic though. It's like any tool. You can abuse it, you can use it. If you think about Borders books and Barnes & Noble, book buying was a local phenomenon. You would walk to the bookstore, read the book, buy the book, go home. They're gone. I don't see it completely going that way, but I see a subset of plastic surgery procedures in patients going virtual, in the sense that they'll say, I want breast augmentation. Well, I'm going to go to Dallas to get it because I'm going to see this doctor. I'm going to fly in, spend 5 days, fly out. The consumption of plastic surgery, like books, part of it will become less of a local phenomenon where who in my hometown does breast augmentation? Well, this person's 2 miles away, this person's 5 miles away. This is my limit. I think with the virtual consult, the world is your limit, and you can be a consumer of plastic surgery wherever you feel you want to go.
Yeah, we've seen that happen. I mean, we have patients who fly in from different parts of the world to come to I know Dr. Vecchio, and we have colleagues who have international patients. And so I think it's already happening. We'll probably see more of it.
And that's a reality we're seeing right now. Thanks a lot. If you want some more information, go to theplasticsurgerychannel.com.